This is another short video showing us what to focus on when we're looking at ECG strips that ask for our interpretation. Today we're going to talk about ECG strips that have the dominant pacemaker as the SA node, causing sinus rhythms. In this case, you find this in your quiz. They ask you for your interpretation. The first thing you need to answer is, what is the dominant pacemaker? We see normal P waves, normal appearing QRS waves. So we know the dominant pacemaker is the SA node, and we know that the SA node produces sinus rhythms. Next step, heart rate. This is a good example for the interval method on getting the heart rate. 300, 150, 100, 75. So the heart rate is 75 beats per minute. There are no other abnormalities on this strip. So we don't have to put anything in our answer if there isn't. So the answer to this particular interpretation is a sinus rhythm, or you could call it a normal sinus rhythm, heart rate of 75, and that's all you need. You don't have to tell me in your answer that the P waves are normal, the QRS are normal. That's understood when you tell me it's a sinus rhythm. Again, when you're on step 3 and you find there are no abnormalities, you don't have to put that in your answer. So we go down to the next example, and this is a little different because this is an abnormal sinus rhythm. We take a look at this. First thing we have to do, though, is we have to find out what is the dominant pacemaker. And again, we have normal P waves, so we know it's the SA node, so we know this is a sinus rhythm. When you're talking about sinus rhythms, not all the time, but most of the time, the reason they're abnormal is because the heart rate is either too fast or too slow. So if the heart rate is greater than 100 beats per minute, that puts it in the category of being a tachycardia. If you have a sinus rhythm and the heart rate is lower than 60, that puts it in the category of a bradycardia. So we get the heartbeat. Again, you can use the interval method pretty good here. 300, 150, but there's a little gap here. It's not exact. So I did this with counting the small boxes and dividing into 1500, and I got 125 beats per minute. No other abnormalities in this strip. So our answer to this interpretation question would be, it's a sinus rhythm, but because the heart rate is faster than 100 beats per minute, it puts it in the category of a tachycardia. So this is a sinus tachycardia, heart rate of 125 beats per minute. The last example is this strip. Again, first thing you need to do is, what is the dominant pacemaker? We see normal P waves. Even over here are normal P waves. So the SA node is a dominant pacemaker. The SA node produces sinus rhythms. Heart rate, I just divided the small boxes into 1500, and I came out with a heart rate of 83 beats per minute. Now, this is the first ECG we talked about that you're going to actually have an answer for on the third thing you should check for, and that's any abnormalities in the strip. And you have an abnormality right here. And if you remember, if you go back slide 53, this abnormality is either a sinus block or sinus arrest. I'll just tell you right now, it's a sinus block. So your answer, to get full credit, reading this ECG interpretation will be sinus rhythm, or sinus rhythm will work, heart rate of 83 with a sinus exit block. Or it could be a sinus arrest, but you're going to have to take my word for it. It's a sinus exit block. Again, any questions, please let me know. Thank you.